it's Michelle from Movement Lesson. Every day I'm somewhere offering more information how to help your child. Movement Lesson offers your home programs, Zoom, in-clinic visits, training, clinic courses, everything that you need to do to help your child, especially with special needs, but not especially with special needs. Movement is movement. It's the greatest gift you can give your child. Please subscribe so you can get notified every time that there's something on. And in these videos, what I'm showing you these are videos that I do on my group, Movement Lesson for Parents and Practitioners. So you might want to go over there and join it. Meanwhile, again, hit the subscribe, hit the like, it bumps the feeds, and enjoy. Thanks. Hi, it's a great question about the Prisms, and I just thought it would be better to do a quick video just to show you. I'm not saying to do or not to do Prisms. I'd answer the question because I'm familiar with Vanessa's daughter, and so that's where I gave my comments. Every child is different. There's certain things that go on with your vision that have to do with spatial awareness. So when a baby is just a little bitty infant, right, what is happening is not necessarily eye-hand, but the vision is starting to cross midline, right? That's the first big setup that starts to happen. Now as the baby starts coming, or your child starts coming into sitting, a big milestone that's meant to happen now is not only that the vision, again, is crossing midline in a more vertical positioning, but you're starting to get visual arcs. So it's not, again, people think of just convergence as this, and I really don't bring stuff to my eyes like this, except if I'm my age and trying to read a label on a can. I might bring and watch it and bring things into my mouth and holding things, but I start going into visual arcs where I'm coming down, picking up an object, looking up at you, going down at an object. So I'm again crossing my midlines here from my left to my right, but my vision is working on my spatial. Next big key now with vision is a midline crossing within the vertical. And that is not only going from here, but now I'm going into where I'm reaching, right? So reaching, see how I cross my midline with my vision, and then I'm going into all fours. So depending on where your child is with milestones, oh, and one last one. Now I'm going into, let's say, cruising and walking. One of the biggest things that interrupts this process is, again, that visual midline has not set up. And now I have to go from looking at my couch, which might be, let's say, a near vision, and now I have to have transitional midline and going into a far convergence to a little one, and that's walking down the hallway. So it's one thing for me to look at you and have, let's say, a visual convergence this way. But to go down now a hallway and then back to this is where it creates a lot of problems with getting your child to, let's say, start walking, because they're so used to a short vision. They look down, very similar to a motorcycle. Where's a motorcycle going to go? It's going to go where you're looking. So if I look down, my bike's going to go down. Same thing with my butt. And so you have those kind of transitional visual midlines that you really want to accomplish in with your program that you're doing with your child. In some cases, and again, individual thing, you don't want to interrupt that process, possibly with Prisms. Prisms really have to be done full on with the understanding on how you're going to implement that program. But if I'm sitting here and I'm trying to get an object, and the prism is throwing off that in a sense, that depth of field, even though it's only a foot away to my side, I might stabilize and not look down. It can sort of interfere with my peripheral vision. Again, these are just questions to ask and notice on your child for your child to be successful. Vision, the reason it's sometimes so difficult for parents and for some professionals is because of that tailored individual that needs to be done for that person. So if they're delayed in milestones, you want to incorporate that vision so the spine's moving and you get that synchronicity within the vision, because it's not eye-hand, it's eye-spine hands. and then it's eye pelvis hands, and then we're going into eye foot hands. So you want the system, the body, to be incorporating into your child's vision. And then you can have just a visual problems where the body is milestoning okay, and again, that would just be different approaches that you're using, and usually in those cases it's more structural based that you're trying to work with. And then you have, again, where you can have trauma to the system, or you can have genetics. And that conversation is going to be, again, tailored to your child's need. So those are some of the things that I would say considered with working with Prisms that need to be addressed for your child. So I hope that helps. I just thought it was easier to throw in a quick video than trying to type it up, and because it's just not always easy for me to type movement versus just to show you. And I'm happy to explain this more if you need, but that's where I was going with my comments.